All right, good afternoon, everyone. This is Shannon Kalis with the Hectone Institute. Welcome back to our biweekly long-term care and congregate care infection prevention and control update call. Please note that, as usual, all attendees are in listen-only mode. If you do have any questions during the presentations, please submit them in the Q&A pod. And a recording of this webinar and a copy of the slides will be sent out after the webinar is over. And then we will be offering continuing education once again for attending this webinar. You'll be prompted to complete the evaluation survey after the webinar is over. So please be sure to do that if you want to receive your credit for attending. So today we will start by looking at the upcoming webinars. And then we have a brief update about the changes to CDC's respiratory virus guidance, followed by a presentation on the Extensively Drug-Resistant Organism Registry, or the XDRO Registry, after which we will open it up for the live Q&A. So here's a list of the upcoming webinars for 2024. A siren did go out announcing these, so please use that to register if you have not already. And we will be offering continuing education for all of these webinars. All right, now I will turn it over to Yvonne for the CDC respiratory virus guidance update.
Hello, all. This is Yvonne Overton. I'm an infection control coordinator with IDPH, the Regional Infection Prevention Program. And I just wanted to give everyone an update on the new CDC guidelines that came out recently on respiratory virus guidance. Next slide. So the new guidance that came out is the community-based guidance for respiratory viruses. The updated guidance is for community-based settings only. It does not apply to healthcare settings. The healthcare guidance for all healthcare settings is unchanged, and it's not expected to change any time in the near future. So what you can see on this slide here is healthcare guidelines apply to skilled nursing facilities, acute care hospitals, long-term acute care hospitals, and critical access hospitals. The ones on the right, in the right column, they follow the updated community-based respiratory guidance. So assisted living, supportive living facilities, sheltered care, specialized mental health rehabilitation facilities, and group homes. Next slide. The updated guidance applies for facilities which provide non-skilled personal care, such as the ones I just listed. Healthcare personnel providing healthcare to one or more residents in a non-skilled facility should follow the CDC healthcare guidelines, which are already in place for healthcare. For example, if you are working in physical therapy or wound care, IV injections, catheter care, or hospice care. Next slide. Also, we want to remind everyone that people 65 and above should now receive an additional dose of the updated 2023-2024 COVID-19 vaccine. Older adults are at increased risk of severe illness, hospitalization, and death if they get COVID. ACIP recommends a second dose this season for additional protection. An additional dose should be at least 4 months from the initial updated dose. Thank you.
Great, thank you. Now we will turn it over to Maivu for the XDRO Registry presentation.
All right. Good afternoon, everyone, and thank you for joining us on your Friday to learn about the Extensively Drug-Resistant Organisms Registry, also more commonly known as the XDRO Registry. Like Shannon said, my name is Mai, and I am an HAI epidemiologist and the XDRO lead on our HAI team. Next slide, please. Today's objectives will include an explanation of the XDRO reporting requirements, including upcoming administrative rule changes, and provide a demonstration of how to use the XDRO registry. Next slide, please. So before we dive into the content, I wanted to do a quick poll to gauge everyone on the calls utilization of the XDRO registry. So the first question asks, do you or someone else at your facility have access to the XDRO registry? Yes, no, or maybe you're unsure. And the second question asks, does your facility query the XDRO registry for new admissions? So we'll just,
The poll is open. If
okay.
it should have popped up, if you do not see it, bottom right, 3 dots on your screen, click on it, and you should see polls. Click on it, it should open it up. But it is up and running.
So maybe we'll just give it another 30 more seconds, and then Michael, you can close it, and then maybe if we can see the results.
Certainly.
All right, 5 more seconds. All right, I think you can close it now. Okay. So it looks like we had, for the first question, do you or someone else at your facility have access? We had 23% say yes, 12 said no, and 15 were unsure, and some no responses. And then for question number 2, does your facility query? We had about 14% yes, 20% no, and 15% unsure. Okay. And so next slide, please, Shannon. And so getting it back to the XDRO registry, the XDRO registry serves 2 main purposes. The first is for surveillance, where facilities, labs, and IDPH reports the XDROs into the registry. And on the figure here, we can see that for the current mandatory CRE and Candida auris reporting, these are reported from all Illinois facilities. And for CP, CRPA, and CRAB, IDPH enters these directly into the registry. The second purpose is as an information exchange. And the reason I asked the previous 2 questions is due to the new administrative code adoption, certain facilities will soon be required to use the registry for interfacility communication. So long-term acute care hospitals, skilled nursing and intermediate care facilities, and dialysis facilities will be required to manually query every new admission. And acute care and critical access hospitals should be enrolled in automated alerts for the XDRO registry or be manually querying if their facility has not been set up yet. Next slide, please. And so the new requirement has been passed for the new administrative code, which will require the following healthcare facilities to query or implement alert notification with the XDRO registry in order to identify new admissions with XDROs. And again, these includes hospitals, long-term care, acute care hospitals, skilled nursing and intermediate care hospitals, and dialysis centers. Another administrative code that has been added allows IDPH to make CRE, CORIS, CRAB, and CRPA reportable. CRE and CORIS were previously reportable, but they were reportable under 2 different admin codes, and now all of the XDROs are reportable under the same code. Additionally, the time frame for reporting has been updated from 7 days to 3 days to report positive cases to XDRO. And I will dive into each organism and disease and discuss their mandatory reportable status and how they are reported. And so the XDRO reporting for carbapenem-resistant Enterobacterales, or CREs, has been mandatory since 2013. As previously mentioned, the new administrative code has been passed and includes a change in reporting timeline from 7 days to 3 days. And labs and facilities report the CREs directly to the XDRO registry. Long-term care facilities may arrange to have their labs report on their behalf. This is the CRE definition for reportable case. In order for a CRE case to be reportable, it must meet one of the following requirements. This has not changed from the previous definition, so this is the same definition that has been previously used. So the positive result must either be one, a molecular test, such as a PCR, which identifies a specific carbapenemase, or two, a phenotypic test, such as MSIM, which identifies carbapenemase production, or for E. coli and Klebsiella species only, the culture must be non-susceptible to one of the carbapenems, doripenem, meropenem, or imipenem, and also resistant to all third-generation cephalosporins tested. You are required to report the first CRE event per patient encounter. So for example, let's say John Smith tests positive for Klebsiella pneumoniae in January and then is discharged. Later, he's readmitted in February and tests positive again for the same organism. So you would report that second encounter as well, even though it's the same organism. If the case of CRE does meet this definition, then again, you'll be reported or required to report the case to the XDRO Registry within 3 days of receiving the report. I'm not going to go through this chart, but I just wanted to leave it here as a resource. This is a useful flow chart that you can use to help determine if a CRE case is reportable per Illinois surveillance definition. And I understand I've gone through the previous slides pretty quickly, so I just wanted to provide this as a resource. So that you're able to use this flow chart as a tool to determine if a CRE case meets reporting definition. For Candida auris, these cases have been mandatory reportable since 2016. And again, the new administrative code for C. auris has been passed and is the same code as CRE. Labs and facilities currently report positive C. auris identification into INEDS through electronic lab reporting, and then IDPH enters them into the XDRO registry. We are currently working to provide direct INEDS to XDRO data flow so that whenever a lab report is reported into INEDS, it will be automatically updated in XDRO. And then we also plan to open up XDRO to allow for manual C. auris reporting if a lab cannot submit via ELR. And so then providers and users will be able to enter positive cases into XDRO. This is the current Illinois C. auris surveillance definition. A confirmed C. auris case is defined as a person with confirmatory laboratory evidence of C. auris using either a culture or a validated culture independent test, such as the nucleic acid amplification test. And again, this, if the case meets definition, the timeframe for reporting is within 3 days of receiving the report. Carbapenemase producing Pseudomonas aeruginosa, also known as CP-CRPA, is currently not mandatory reportable. These positive cases are mostly identified through point prevalence screenings. And to report CRPA, the facility or the local health department will notify IDPH, and then IDPH will enter the confirmed cases into the XDRO registry. Do note, though, that this organism will eventually be mandatory reportable under the new admin code. Similarly with crab, it previously has not been mandatory reportable. IDPH did lead a pilot surveillance between 2019 to 2022, which is where a majority of the cases in the XDRO registry come from. And in addition, they are found at through PPSs. These cases are entered currently by IDPH and will eventually be mandatory reportable under the new administrative code. These are the surveillance definitions for CP-CRPA and CRAB in Illinois. A confirmed case of CP-CRPA is defined as Pseudomonas aeruginosa with a positive molecular test for carbapenemase or a positive phenotypic test for carbapenemase production. The definition of a confirmed CRAB case is Acinetobacter baumannii resistant to a carbapenem or a positive molecular test specific for carbapenemase. So now we've gone over what the reporting requirements are, and now we'll go through how to actually use the XDRO registry. So we've covered what's reportable, but how do we actually report it in XDRO, right? That's the biggest thing. The first step is making sure that you have access to the XDRO registry. This is a screenshot from the XDRO registry website, and I've also provided the link here. New users must register for access to the IDPH web portal and request access to the INEDS and XDRO applications. So for those who already have access to the IDPH web portal, for example, if you already have access to the iCare system, but you don't have access to INEDS or XDRO, you have to request your portal registration authority or your PRA to send an email to DPH security and request access for you. For those of you who might not know, your PRA is someone at your facility who has been authorized to approve users at your facility. And if you don't have a PRA, you or someone at your facility can apply to be your facility's PRA. You can also find instructions on setting up a PRA on the website as well. And finally, if you already have access to the IDPH web portal and INEDS, you should automatically have access to the XDRO registry, as those two apps are granted together. So if you have one, then you have the other. If you've gone through all of these steps and you still have issue accessing XDRO, please send our team, the XDRO registry team, an email. And as a new user, you'll click the new users link here, which is that first one. So for a user registering for new access or access to the IDPH web portal, this is what the portal registration form looks like. What you'll do is you'll fill out this form with your facility and workplace information. And also of important note is that if you change facilities or workplaces, but you still need access to INEDS or XDRO, so for example, if you were working at a previous hospital system and you move to a new hospital system and you still need INEDS and XDRO access, you do have to re-register for access using your new facility and workplace information so that you can report on behalf of that new facility. This is the second half of the registration form. At the bottom, you'll be able to select which apps you want access to. So you want to make sure that you select access to INEDS and XDRO registry. Again, you'll be granted access to both surveillance systems. This is also the same form that you would submit to request access to iCare, which gives you access to resident records. And so once you've submitted your application, you should receive an email like this from DPH Security. Your PRA or Portal Registration Authority should be CC'd and notified of your request for access. And from this point, it's up to your PRA to approve before IDPH can move forward in enabling your account. Now, once your PRA approves your request, you'll get a response email like this from your PRA saying that, you know, it's been signed and they approve. And keep in mind that one of the delays to access for IDPH applications is waiting for PRA approval. And so, for example, this is a real example showing that there was a 10-day delay in approval from the PRA. And so please ensure that your PRA is providing approval in a timely manner, because the IDPH teams cannot move forward without this approval. And once your PRA approves access, you'll get another email like this requesting the IDPH help desk to grant you your account access to the applications. One important thing to note is the highlighted text in that email that states, this email serves as the approval to activate your INETS account. Your account is not activated yet. Please allow up to 6 weeks for your account activation. You'll be notified by DPH Help Desk once your account is activated. Sometimes we have folks who've just applied like the day before, and then they'll send us an email saying, I don't have access to XDRO. Unfortunately, that is still, you know, in the process from DPH Help Desk and the IT team. Our XDRO team cannot do anything until those apps have been added to your IDPH portal. And so sometimes it's just a waiting game to get those approved. But sometimes, you know, if your PRA is responsive and they can get through those processes in a few short weeks. So next slide, please. So final account activation. And so receiving this email means that your account has been enabled. You should have access to INETS now. So you should be able to log into your IDPH portal and access your INETS app. The XDRO team updates our user table every Friday. And so if you get INETS approval on Tuesday, your XDRO access might not be live until the following Friday or Monday after your INETS account is activated. So do keep that in mind as well. And this email will show you instructions of how to log into your IDPH portal to access the applications that you've requested access to. Next slide, please. All right. So once you've gone through all of those steps to request access, now you have access. How do you log into the XDRO registry? So to log into the XDRO registry, again, you must enter through the IDPH web portal. The link is on this page here. The URL is on this page here. And then once on the site, I would recommend that you bookmark it so you can just come back to it easier. And what you would do once you're on this page is you'll click that hyperlink there that says DPH portal login. Once you click that, you'll be prompted to enter your username, which is provided by IDPH, and then enter the password that you set up. And once you log in, you will land on the IDPH web portal website, which looks like this. Then you'll go over to that first link on the tab and select application, and then select production apps from the drop-down list, which is in that red circle there. Once you are on your production apps, it'll list the rest of the apps that you have access to. So if you have access to INETS and iCare, they will all be in the same list as the XDRO registry. From there, you'll select the XDRO registry, and then it'll open up a new tab and ask you to click the X to enter the external XDRO registry website. So then you'll click that blue X, and then you'll land on the XDRO registry homepage. So if you followed all of the correct steps, your username is authenticated, you'll be directed here. You'll have 5 buttons on your home screen: the Submit Report button, the Facility Submission History, XDRO Dashboard, Search Registry, and the Facility Alert History. We won't get a chance to go through all of these today, but we are going to review some of them. And so I want to do a little bit of practice so we can familiarize ourselves with what meets criteria for reporting, right? Now we know how to report. What do we actually report? So this is a CRE case. As we can see, hopefully, I know I understand this example lab report is a little bit difficult to see, but we can see there that it's CRE, Klebsiella pneumoniae, is the organism. And right under that, it says CARBA-R PCR results, OXA48 detected. So that is a specific carbapenemase, meaning that this is a reportable lab that we can report into the XDRO registry. Next slide, please. This is an example of a phenotypic test that is acceptable to be reported into the XDRO registry. Again, that second criteria is a phenotypic test that is specific for carbapenemase production. And the example lab report says that carbapenemase production detected using the modified carbapenem inactivation method. So that meets our surveillance definition to be reported. And on the right-hand side, bottom side here, these are the XDRO options that you can select for the type of test that is used to confirm. And so you would just click the box for MSIM, modified CIM. Next slide, please. This is an example of CARE identification by susceptibility testing. Again, that criteria is defined as only for E. coli and Klebsiella species, non-susceptible to one of the carbapenems and resistant to all third-generation cephalosporins that are tested. So if we look at this example lab report, we can see the organism is Klebsiella pneumoniae, which applies to this definition, this criteria. We can see that it is resistant not only to one, but two carbapenems, and then it is resistant to all third generation cephalosporins that were tested. So this would be an example of a reportable case. Next. So how do we actually report? Now we've got a positive lab report that we've received. How do we report that into the XDRO registry? When you go back to your XDRO homepage, again, you have those 5 buttons. You'll select Submit Report. The Submit Report button will open up this form, and there are 3 sections. The first section is the XDRO culture information. That's where you'll put what organism it is and which test was used that meets the reporting criteria. The second section is the facility information, which the facility name will be auto-populated by your account. So let's say you're reporting on behalf of Holy Family. The facility name will say Holy Family. And then you'll enter the patient medical record number and then date of admission or the encounter date. The last section is the patient demographics, and this is where you'll be entering the patient information. Any field with a red asterisk is required to be filled in, and so you won't be able to submit a form if you are missing any required information. Once you enter all of the information and you click submit, this is an example of what the report summary looks like. Again, this is an example for CRE that met the molecular test criteria. We'll see here what the organism is. It's a CRE, and the mechanism of resistance is KPC. This is an example of a CRE report where the positive case met a phenotypic test. And so again, you'll see it says phenotypic test and then which type of test that met the reporting criteria. This is a CRE report that shows the summary of antibiotic susceptibility testing, which is that E. coli Klebsiella resistance criteria. And again, you'll see that the organism is Klebsiella pneumoniae. And just so everyone is aware, the patient information area will look the same, but depending on the organism, the information at the bottom where it says XDRO culture will be where you should be looking to see what organism and when it was collected and what the specimen source was. So this is an example of a CORIS report. Currently, IDPH is the one who enters these, but users are able to view if you are querying for during admissions or querying to see if any one of your patients have history. So the organism will say Candida auris. Same for crab, the organism will say Acinetobacter baumannii, and then oftentimes you'll see a mechanism of resistance associated with these organisms as well. Then for CP/CRPA, it'll say Pseudomonas aeruginosa and have a mechanism of resistance. So we've covered entering a case, but what about editing or deleting a report? These are the only reasons that are acceptable for editing or deleting a report. So if there is a data entry error, it is found as a duplicate record. So maybe you and another coworker entered it, or maybe IDPH entered it already and you didn't know, you entered it again. If there was a laboratory testing error, if it doesn't meet reporting criteria, or it was determined not to be a CRE through molecular testing, or a patient is deceased. Decolonization and infection resolution is not a valid reason to delete a record in the registry. So if you need to delete or edit a report that you've entered, you'll open the report, and at the bottom there should be these 4 buttons: go back, to edit, delete, or print. If you need to edit something, you'll just click the button, and then the report entry page that we just saw will reopen, and then you can edit whatever information needs to be edited. And then in order to delete, you'll click on the delete button, and then the bottom pop-up in the right-hand picture here will show up, and you must select a reason for deletion. And again, you'll notice that there isn't an option to select decolonization or infection resolution on there. So just wanted to reiterate that currently IDPH is the only one that could enter C. auris, crab, and CP/CRPA cases into the XDRO registry. Facilities and labs report to INEDS, and then the HAI team enters these cases into XDRO. Providers can also send confirmatory lab reports via secure fax at this number here, or an encrypted email to the XDRO email, in addition to completing an INEDS case report. And sometimes that will notify us a little bit quicker, and so we can add it into the XDRO registry. And then again, just to reiterate that provider reporting of C. auris into XDRO is currently being working on. so that providers can report directly into XDRO for positive CRS cases. So let's go over a scenario to see how you would actually use the XDRO registry in your roles or at your facilities. So let's say that you're a long-term care admissions coordinator and you received a phone call from the hospital regarding a new admission. So what you would do is you would query the XDRO registry, and this is just the information you would need. Is you would need the patient's name, full name, and their date of birth. So then what you'll do is you'll log into the XDRO registry. You can go to the next slide, Shannon. You'll go to the XDRO registry and you'll manually query the patient. So you'll click the search registry button on the right-hand side there. And then you'll have the fields to enter the patient's last name, their date of birth, and their first name. Their first name is not a required field to be entered. And so again, here's an example where I entered that patient information. So this is a fake person that I'm using. So I just called them fake person. So the last name was person and their date of birth. And so these are all of the cases that this individual has been positive for in the past. And these are all the example ones that I've entered. So they all have the same date. Most likely they'll have different dates for your patients. An important thing to note is the RID, or the unique report identification number that's given to each report. This can be used when sharing personal identifiers is not advised. And so let's say you want to email us about a specific case. You could use their RID instead of using their full name and their birthday in the email. So now that we've confirmed that your new admission has a positive XDRO history, what would you do? You'll notify your DON and the IP regarding the new patient's history, and then you can also reach out to the regional IP and the local health department for additional support. And I've included here the recent toolkit by Karen Trimberger, who was she did a wonderful presentation of this a few weeks ago for implementing personal protective equipment in nursing homes to prevent the spread of multi-drug and extensively drug-resistant organisms. So this is a graph showing the number of queries conducted from the XDRO registry between 2018 and 2023. We can see that during 2020 and 2021, there was a dip, which may have been attributed to the COVID pandemic and competing priorities. However, we've seen a steady increase for 2022 and 2023. And we estimate that only about 16% of skilled nursing facilities conducted a query in 2023. We're also currently working to get CMS certified skilled facilities connected to auto alerts, which might help with the burden of having to manually query. And so this is just a statistic that I wanted everyone to know, especially with the poll questions that were asked earlier in terms of if anyone queries. And so this is a diagram that gives an overview of how the auto alert process works. Since we are working on, piloting auto alerts for long-term care facilities. So for example, hospital A will generate a list of patients admitted to the hospital. And then the patient in hospital A's encrypted list are checked against the XDRO registry for a potential match. If there is a match, the XDRO registry will send an email alert to the registered users and notify them of the match and request that the user log in to see who the patient was and what type of organism they have a history of. Automated alerts will enable infection prevention staff to more quickly identify patients admitted with a history of XDROs and then be able to place them on the appropriate contact precautions. I did want to go over some of the frequently asked questions that we receive. So one of the ones that I've been seeing recently is access to multiple locations. And so what if you need access to more than one facility? If you're a regional IP for your corporation or company, how do you get access to more than one location? So the first question I usually ask is, do you also need INED's reporting access to the additional facility? In other words, are you using, this access to XDRO just for querying purposes, or are you the reporter for that facility as the additional facility as well? If you are going to be reporting on behalf of the secondary facility as well, that means you have to apply for a new IDPH account with the new facility, so that you'll have two separate accounts, one with your original facility and then one with the new facility. And then if not, let's say you just need it for querying purposes, so that you can, query a new resident if the other IP is out. Then you can just email us and we can work with you to grant you that access to the other locations. So this is just a screenshot of how to change between facilities. On the right-hand side of the XDRO homepage, you'll see a link that says change facility. You'll just click that, and then the pop-up will show up to change your facility, and you can select which facility you are reporting or querying on behalf of. And then you click change, and then the name on the top right will change according to the facility you select. Another question we get is, I have access to INEDs, but I keep getting the "you are not authorized" page when I try to access XDRO. So a few things is you just want to make sure that you're clearing your cache or your cookies and that you're using a browser that is typically compatible. I use Chrome and it usually always works with me. You want to make sure that you're using the correct username. Sometimes we see that users are trying to use old usernames from like a previous job or a previous position. And so you want to make sure that you're using your most current username that is associated with your facility that you're reporting on behalf of. Another thing is, again, if you have just been granted access to XDRO, please wait until the following Friday or Monday for your XDRO access to be activated. And if you've tried all of the above and nothing, has worked, please email us and we can help you troubleshoot further. And so we can take any questions now. And this is also a list of resources. So that's my direct email as the XDRO lead. I've also provided the email of our XDRO registry. You can always email me personally, but best practice is to always CC the XDRO registry, just in case I'm out, someone else is able to assist you. And then there are XDRO training videos. If I went through these quite quickly today, and so if you missed something, there are training videos on the XDRO website, and I've included that there. And also any other questions that you might have and want to reference later, I've also included the link for XDRO FAQs. Thank you.
Hi, Mai, this is Connie. I have a question regarding reporting. Are both clinical cases of CRN's Candida auris as well as screening results reportable?
Yes.
Oh, okay, thank you.
Rachel and Simone, do we have any more unanswered questions from the Q&A box?
Just one here. One of the challenges I have encountered is if the last name is hyphenated or if the residents have middle names entered. Just maybe more of a statement.
For like querying?
Yes.
Yeah, so if you aren't able to find them and maybe you're concerned that maybe the last name is just spelled differently, like whoever entered it didn't add the hyphen, or maybe they did a space, you can always email us. We can go in on the admin side and search with less restrictions. So if that is the case and you're, afraid that you're not able to find that individual because their name is spelled differently, just email us and we can assist you with that.
In encrypted email, please, if it is emailed.
Yes.
So there's one more here. It says, I've had access to XDRO. When I try to access INEDs, it states denied access. I've worked with IDPH. Help desk would still not resolve. Should I have access to INEDs?
Yes, you should have access to INEDs if you're able to access XDRO. That sounds like that might be an issue with, I don't know if that's with INEDs or with DPH security, but that unfortunately is something you would have to work out with the INEDs team.
Hi, it's Mary Alice. Can you just explain to them where to look for that INEDS access? You might have a slide where it shows how to click on that production app section and where the two would show up.
Yes, keep going. So, yep, that one. So when you click on production apps, on another page will show up. So if you go to the next slide, Shannon. I actually just cut it out, the XDRO app, because on my app, I have like 10 different apps and I didn't want to bombard everyone with all of the other apps that I have access to. But in the same list, after you select production apps, you should have the INEDS app as well in this list. So you would access INEDS through the same IDPH portal as you do to get to the XDRO Registry app.
When a PRA or IP is leaving the facility, where should they send the notice?
They can send it to the help desk. I'm typing it into the Q&A box, so you'll have it, the email address, I mean.
Thank you. Will XDRO access be mandated at some point for ACH or SNFs?
Access, I don't know. I mean, since we are mandating reporting and then either auto alerting or querying, you pretty much have to have XDR access to be able to complete those functions. So I guess in a way that's mandating access, although perhaps not explicitly, but acute care hospitals and skilled nursing facilities, they do need to have XDR access.
Thank you. What if your facility does not have a PRA? How do we go about accessing that? Oh, I saw Mary Alice answer that.
I see Carol also asked, that she has the iNets app but cannot access it. Again, I think that would be an issue that you'd have to address with the iNets team, since we don't control or have the administrative authority over that application.
For now, other than if you can send the email for the teams, that seems like all of the questions.
Okay. Thank you, Rachel and Simone. And thank you to all of our presenters and panelists. We are gonna, since there are no more questions, I think we can end a bit early today. Thank you all for joining. Thank you all for the excellent presentations. Please complete the CE evaluation survey once this webinar closes to receive credit for attending today. Also, please register for Siren if you have not already, and please check out the Telegen website for some awesome resources to help improve infection control. Thank you, everyone. Have a great weekend.